MrPopZit here. We have some extractions today with a patient that you guys love. She should be a relationship counselor, I think. You haven't met a man yet, have you?
No, I'm still available.
All right. We're going to do some squeezing here. Now, she's got kind of like a collection here of pores you can see when we squeeze. Now, this most likely isn't an epidermal inclusion cyst, but kind of just a pocket you can see here that fills with keratin with multiple dilated pores of Weiner. So she's got some dilated pores there. And, you know, it kind of fills up and it can be kind of tender and feel like a nodule. And sometimes when we squeeze these out, we can do a little Kenalog injection there and it may bring down some of that inflammation and kind of shrink it up a little bit. Hopefully, that's what we hope for.
I seen a commercial the other day on Hidradenitis.
Oh, yeah. Suppurativa. Yeah, we see a lot of that.
The doctor said that I had that.
It's not usually on the face, but you could have it in other areas with under the arms, right?
Yeah. And down there.
So when you move, finding a dermatologist in your new state is important because there's a lot of treatments for that, and it can be stable for a while, but sometimes it flares. And it can get bad and cause new scars. And it's not uncommon for people who have that actually to have kind of bad acne on the face or pitted open pores like this.
Oh, I used to have it so bad. It was it started turning in when I got pregnant.
Yeah.
And I really got them really bad when I had my son.
Oh, man.
Now my kids got that stuff.
You know, I've had patients with severe hidradenitis and they get pregnant and it goes away, and I've had other patients that it's mild and then those hormones start going and it gets really bad during pregnancy.
Yeah, mine didn't start coming till I was like 7 months pregnant with my daughter. She's 50 now.
Yeah, it can. Oh, okay, sorry. Might be my light's too bright too. Yeah. Is that better? Mm-hmm. Yeah, sometimes my hands get in the way.
But even though I had all my sweat glands taken out under my arms, this one right here still bothers me sometimes.
You had a little surgery, or?
Oh, I had deep surgery.
Yeah. You have cut out on the cheeks some of your large pores. Up here by the eye, it's not fun to have stitches, but kind of keep an eye for you. I'm going to roll this across. There we go. So many pores here that are affected from this little pocket.
Mm-hmm.
Now at the end, we'll do a little Kenalog shot there. It stings for just a minute, but hopefully it'll take down this whole area that's kind of puffed up a little. That's good. So I'm going to come down here and we do some finger squeeze on your nose here. And we've had some good clearance. I know that's not fun, but we get it out for you. There we go.
I usually just push it up.
Yeah, I know. A lot of people do it. It just keeps filling. That happens. But, you know, we get these pores cleared out. It's nice to get that gunk out.
Yeah.
I'll have you turn this way just a little. There we go. A couple big clogged pores right there. Perfect. You're doing great. Bit up there and back here. Not too painful? Good. Nothing like a good finger squeeze sometimes. It just, you know, you can clear out 20, 30 pores all at once, just like that. That is good. Right here just to focus. We got a little cartilage behind it up here. See if we can push out some of these little blackheads. Right there. Yeah. More focus, can be tendered a little bit. And we're pretty good on that pore too. Come down this way. You got some on the side here. Almost there. Got one right there.
Dr. Lynch, why you decided to be a dermatologist?
No, it's a good question. You know, I'm a very visual person. You know, I'm a musician. I'm a songwriter.
Oh!
They say they're very visual. And so I in my 20s, I spent 8 or 9 years in Europe and on the road, traveling as a musician. And when I came back, I had friends that were dermatology PAs, and I'd worked a lot of jobs. I delivered pizzas. I loaded planes for UPS. I was all over the place. I delivered those bounce houses that kids jump in the back of a yard. I did a lot of different jobs, and I was like, can I follow you for a day and see what you do with my friends? And I was like, this is amazing. You get to help people. It's very visual. I was always a pimple popper. Always. When I was on the road and there'd be ingrown hairs on the necks of some of the guys that were in the van, I'd be like, I'll get that for you. Come over here.
Oh, no. My stepdad used to make me pull his out.
Oh, yeah. All the time. Little pimples.
Yeah.
These are actually pretty dry over here. It's not bad. It's mostly the nose. I don't see too many bad blackheads over here.
That's interesting.
Yeah, so I came back and I was like, I like how visual it is. If you're going to get into medicine, people usually don't die in dermatology. It's like in the ER, so things like that. So, you don't want people dying all the time.
Okay.
Yeah, so I was like, it seems like a good choice. And I'm glad I did. I really enjoy it. Let me see over here. Got most of those on the nose here for you. And I know those just kind of keep filling. Using a retinoid like Retin-A can help tighten some of these pores.
Where do I buy that at the pharmacy?
Yeah, well, there's one called Different. It's over the counter. It's adapalene. It's one that's pretty cheap, and you can just get it at Target or Walmart. And I'll write it down for you. Yeah, Different 0.1.
I was going to ask you about that because I just put cocoa butter on my skin. Wash it with hot water and put cocoa butter on it.
Yeah, well, it'll reduce oil production, and it does help. There's some right there at the top. It helps kind of tighten some of the pores, reduces that sebum production, and that can help kind of get these a little tighter for you. You see one on the chin, a little blackhead right here we're going to get. And right there.
Yeah, every once in a while, that one will turn white.
Yeah, they can kind of fill up like that. You push them out. That's good. Down here. I can see you keep them pretty clear. Most of these, they don't have a whole lot in them. Just a little bit. Well, you get on that topical cream, that's going to help reduce it too, which will be good. Sorry, a little pain on that one. We probably did about 30 or 40. And her cheeks are good. Yeah. Compared to the first time I saw you, you were definitely a lot more full. Around the nose, though, these can pile up easily and kind of quickly. But we're going to write down that Different for you so you can pick up at Target or Walmart. It has the best price, and I think we'll have a good reduction on the nose here. You do that every night before you go to bed.
Okay.
And that's good.
Now, what about a moisturizer? Because I noticed the cocoa butter is not really a moisturizer.
Yeah, I like... CeraVe or Cetaphil are some nice moisturizers that you can get.
That CeraVe got alcohol. It burns my hands.
Well, the facial one, the facial moisturizer is pretty good. It's CeraVe AM and PM. The PM is very light. That shouldn't burn you. It's pretty nice.
Can I use it every day?
Every day. You can use it twice a day, morning and night. If you're going to be outside, in the sun, turn this way just a little, just getting these top pores here. Going to be in the sun, it's good to get one with a little sunblock in it and reapply every 2 hours.
I don't be in the sun that much.
Yeah, no, I don't either.
My 15 minutes is enough.
That's good. So we got this pretty cleared out. Nothing more is coming out of there. Now, it's going to be a little pinch. It's not going to be fun, okay? And then we'll be all done. Hopefully, we'll get this little raised area to kind of go down with that. Good. A little pinch here, okay? We're going to go just light right here. It's going to sting. There you go. You did great. Put a little bit in there. You can see it's coming out the pores even. Okay. Good. Just 0.2 in there. She's good. Perfect. We'll get a little Band-Aid for that. And let's check back in 6 weeks, maybe one more time before you move.
Okay.
And then we'll see how this did, and we'll have that using that adapalene, see if we can get a reduction on the nose, okay?
I hope it ain't going to leave a hole in my face like the other two. Okay,
no,
good.
That shouldn't leave a hole.
These two right here, man, they're so ugly.
Yeah, those bigger pores. I know.
Can you feel them?
Oh, yeah.
You can feel those?
Well, no, the pores over here. You have those enlarged pores. Okay, so we're good. Thanks for popping by, guys. That was another extraction, just kind of clearing the nose for her, getting her on a good retinoid. Will hopefully carry on, you know, for months and months and years afterwards. So we'll see you soon.